The effects of adverse childhood experiences on the physiological and mental health of individuals in adulthood. So what are ACEs? ACEs are essentially traumatic experiences that an individual undergoes during childhood. So there are three types of ACEs. The first one is household dysfunction, which includes such aspects as parental divorce and parental alcoholism. The second one is abuse, which consists of physical, sexual, or psychological abuse. The third, neglect, consists of physical or emotional neglect. And this study is going to investigate the effects of ACEs on stress coping mechanisms and suicidal ideations. As for previous studies conducted, we've seen the CDC Kaiser study back in 1995, which showed that there was a significant relationship between individuals who scored 6 or higher on the ACEs questionnaire and a lifespan that is 19 years shorter than the average individual. Furthermore, the Kalmakis and colleagues study also showed that there's a significant relationship between ACEs and HPA dysregulation, which HPA stands for hypothalamus pituitary adrenal glands, which means that ACEs mess with that certain part of your brain system, which controls cortisol release. So essentially that would mean ACEs affect an individual's overall stress coping mechanism. As for the third study, Thompson and colleagues, it has been shown that there is a positive significant relationship between an increased number of ACEs along with suicidal ideations.
Our sampling procedure consists of combined strategy sampling. Greenville County schools will be divided based on wealth and socioeconomic status of families. Proportionate stratified random sampling would be used in order to ensure that each subgroup is equally represented. Specific schools would then be chosen from each strata by the method of cluster sampling. Once schools have been chosen, even further cluster sampling would be used to focus on specific classrooms within each school. Random sampling would be used to select groups of students from these classrooms at random. In order to best control for potential confounding variables, the sample size would be kept at 50 students and the age of students would be held fairly constant. We would use a within subjects design, meaning that all students will be exposed to each treatment condition. When participants first arrive, we will introduce each questionnaire and proceed to tell them that all data will be held confidential and anonymous. The responses of each participant will be given a number that is in no association with their name. We will be using 3 questionnaires: the ACE questionnaire, the hair care questionnaire, and the SIQ, also known as the suicidal ideations questionnaire. In order to avoid order effects, the order that participants complete each questionnaire will be held at random. We will also split the sessions into 2 different days and allow participants to go home after they have completed the last questionnaire. The next day, when participants arrive, their heart rates will be measured and hair samples will be taken to measure cortisol levels. Researchers will ask about the nervousness of participants while also asking other random questions to discuss any potential face validity. Once pretest values are measured, participants will then be exposed to the 2 treatment conditions. Participants will first be asked to watch a non-stimulating video and their stress levels will be measured after the video. Then participants will be asked to watch a stimulating video of an angry man screaming. After this treatment, stress levels will be measured once again. Once all measurements are recorded and obtained, participants are able to leave the study.
As for the materials we would need, the first one would be the ACEs questionnaire, which is just a standard 10-question self-report ACEs questionnaire developed by the CDC Kaiser ACE study. You can see a picture of that on the bottom right of the slide, and it shows that it's just a bunch of restricted questions, yes or no options. The second questionnaire is the hair care questionnaire, which will ask the individuals what type of material they use on their hair, and that is just to identify any variables that may confound our measurements of cortisol levels from the hair samples of the individuals. The third one is the SIQ, also known as the Suicidal Ideations Questionnaire. This is a 30-item questionnaire that serves as a valuable component for a comprehensive assessment of the mental health of individuals. The fourth is the heart rate monitor, which we would use to measure the stress levels. It's just a physiological modality of measurement that we would use for the study. The fifth one is the liquid chromatography mass spectroscopy, which is a fancy way of saying some advanced technology that we would use to measure the cortisol levels from the hair samples of the individuals. You can see a picture of that on the top right of the slide. And the last material that we would need would be a television, something to show the footage that's supposed to be the stress inducer. As for the results, we can see the first graph shows us a positive significant relationship between ACEs and heart rate, we would be using what is known as a Pearson correlation, which shows the strength of a linear relationship among two variables. And so with heart rate, we'd expect with the more amounts of ACEs that an individual experience, the higher the heart rate would be because of the lower coping mechanisms of stress that the individuals would have. For the second graph, that we see that as the number of ACEs increases among individuals, the cortisol levels would decrease, and that's because of the HPA dysregulation that we discussed earlier among Komakis and colleagues that has been proven in previous studies. And the last one is the ACEs and suicidal ideations graph. And as you can see, we hypothesize that as the number of ACEs increases, the number of suicidal ideations would also increase, as has been supported under Thompson and colleagues.
We hypothesize that there is a strong positive relationship between ACEs and suicidal thoughts, as well as heart rate levels. We also hypothesize that there is a significantly negative relationship between ACEs and hair cortisol levels. We hypothesize this because of previous studies that have examined such variables, such as the CDC Kaiser study, Kamakis and colleagues study, and another study conducted by Thompson and colleagues. A limitation of this study is the measure of self-reported answers from each participant. Self-reported answers are extremely common and the best way to measure a construct, but face validity can arise and participants can play the apprehensive subject's role, meaning that they are responding to questions with answers that make them look good but may not necessarily be true. Another limitation is the fact that it can be extremely difficult to measure a construct and that best operational definition may not be assessed. ACEs have been shown by this study and many other studies to cause numerous mental and biological health consequences. With this being said, research measuring these risks is crucial and necessary when wanting to take preventative measures and decrease the number of ACEs in today's society.
Thank you for listening.